So first and foremost, what you see here is an etching of a healing abutment. What I like doing is when the patient comes in with healing abutments, before scanning, I will replace those healing abutments with healing abutments that are of the same diameter, only higher. I don't want them to interfere with the occlusion, just be almost in touch with the upper arch, so that occlusion will be advantaged of this technique. Also, if I place these healing abutments, I would like, because they are shiny surfaces, I would like to be able to image them easier. So the ones that I replace in the patient's mouth before scanning are either acid etched, or my favorite are sandblasted. And let's see. If you want to acid etch, you can use an acid and coat the surface of a scan body. Leave it for a minute, and afterwards wash it well. Also, these scan bodies are not to be left in the patient's mouth. So after scanning, they're going to be again replaced with the scan bodies, with healing abutments that the patients came in with. As you can see, the surface started already boiling, and the final result here, you'll see a sandblasted healing abutment. I like them more because they are even less shiny than the etched ones. We're going to seat them, and after seating them, we're going to prepare the scan. And for the scan to work correctly, I want to have the following stages. I want to have a pre-op stage of the working arch, an antagonist, a working stage, the scan body stage, and the occlusion stage. When I start the pre-op stage, I do this because this is the arch I want to help me with the occlusion. So this is why I'm going to have the next options check. I'm going to have a color filter check so that I am able to filter out my gloves. I don't need this arch to be scanned in HD. I just need normal information. I'm going to check the scan metal function, and I also will disable slip checker, because in arches where I have a lot of teeth, there is sufficient vertical information for me to have a correct scan, and I don't need the system to re-evaluate every image I take. So slip checker will stay off. For the first thing I will do, I will start taking the scan of only the teeth. I am going to start with the occlusion surface of the molars from the contralateral side. I'm going to, as you can see here, in the incisal, hover over and do an angulation between buccal and lingual to get enough information of the crowns to have occlusal surface and also some parts of the papilla. Then I'm going to go lingual and also vestibular. And now I'm going to get my buccal scan right. I'm going to just do adding information between the already mentioned occlusal scan and the fixed gingiva scan that I already did. So I'm putting information in, and right now, as you can see, my whole scan is green. I do stress upon having information green everywhere. And please do scan your cases in reliability mode for as long as you feel that you are not very in control of scans. Now, as you can see, furthermore, I'm completing the last pieces of the scan. And I'm going to stop here. I'm not going to take any impressions of the healing abutments yet. So right now, I am going to check my scan. As you can see, I am going to trim any unnecessary data, as you can see in the next image. And I am also going to optimize my data before continuing the scan so that I know that everything I did until now is in correct place. This optimize button that you can see on the lower right is your best friend during scanning. Everything that goes wrong, if you can't continue a scan, if there is a hole in the scan that doesn't fill, anything that you actually feel is not going your way, you just first have to press the optimize button. Once you optimize the surfaces, you can try again. And if then you have problems, continue having problems in scanning, okay, then you are going to have to use another way to mitigate the situation. But first thing you will ever try is going to press the magic optimize button. You will see here the optimization is done, and now we are prepared to continue the scan of the healing abutments. Now is the time to activate sleep checker. And why I do this? Because healing abutments with a fixed gingiva around them are surfaces that are not very high, and the surfaces that don't have a lot of detail. So I will like my software to actually take any image and make sure that the image is in the correct spot. So sleep checker does this, but it also is prone to sometimes lose position of what we are scanning, and because of this, sometimes scans are a little slower than usual, and you'll have to revert to areas that the scanner already did correctly, maybe multiple times. So this is why I only use this function when I feel I have an area that is prone to have not so good information. So I checked sleep checker, and now I'm going to image the healing abutments. As you can see, I'm going to go forward, and now because they are sandblasted and sleep checker is on, it's very easy to take a good impression of these surfaces. I have all the data now, and afterwards I'm going to stop again, optimize again, as I already told you. And when I do this, after optimizing, I'm going to also, because the mesh is done now, I'm going to clean it of any data that is moving tissues that the software until now didn't already automatically get out of the way. Now we are going to start an impression of the antagonist. Things that should be on as far as icons go is on the left, lower left, the filtering tool. HD is not needed for the antagonist. Also, metal scanning is on. Sleep checker, because there is a full arch above, all the teeth are present, is also not needed. So we'll uncheck that as well. Now we'll start doing the scan of the antagonist, as you can see, and we'll try to image the occlusal surfaces of the lateral maxilla, and also get some parts of the papilla, as I told you, on the lower side. So you'll see how I go forward. On the middle portion, I will angle my scanning tip from buccal to palatal and buccal palatal until I get all the information I need. And then going to the lateral side. On the lateral side, I'm going to finish the palatal scanning and go on the buccal, add data there. So you see, we try to have as clean a mesh as possible. And also at this point, I'm going to start, I'm always finalizing the impression with the palette. I always take a full palatal impression because in many situations I needed this palette to be able to align meshes even in the same case at a later date. So please get clean meshes, green meshes, and full meshes if possible. You'll see here as we start from the teeth and go on the palette, we get a full mesh. Okay, and now we are done. And now we have a preoperatory impression of the mandible with the healing abutments in place, and also have the antagonists. So now, before we image the working part, the working area of the mandible, we'll take an impression of the occlusion, for the occlusion scans. We'll take the occlusion scans. So starting with the occlusion scans, and as you'll see here, we tend to go from the molar to the canine region. We are going to, in general, take an impression of 3 to 4 teeth. And this impression being taken, we're going to then stop scanning, leave the scanner to optimize its data, and now, before going to the second occlusion stage, I am going to trim my mesh. In this case, it's not that much needed, but you guys have to see how it's done. I'm usually only leaving teeth and fixed gingiva. I'm cutting out any parts of the tongue or of the moving tissues. After I do that, and I have a cleaner mesh, I'm going to revert to the scan and maybe even optimize once more. On this actual case, I didn't do this. And now we're going to scan the part that contains the healing abutments. On this part that contains the healing abutments, I'm starting the scan from the teeth that are present, and then I am going to take an impression of the teeth and healing abutments. But at this point, I always tell the patient to pull the tongue to the other side. Also, I never let the patient open his mouth. So when I take the first, let's say the right part of the occlusion, when I take the scanner outside the mouth, I tell the patient not to open up, and I'm going to retract the tissues on the other side and put the scanner in. I do this because I tend to see that patients are not going to always bite in the same spot. So if I want to have a correct occlusal scan, I will ask the patient to not open and validate that the occlusion is the one I need and the correct occlusion, and just afterwards start scanning. As you can see, tongue is not in our way because the patient has pulled it on the contralateral side. And now I'll also show you a second way of doing this. So the idea is here to take a piece of material and place it on top the healing abutments. I here use a piece of wax. It's warm now and it's very thermoplastic. I'm pressing it between the upper teeth and the lower scanning abutments. And after I do this, because it's very soft now, I'm going to take the wax from the visible surface of the healing abutments, as you can see here. And also, I'm going to remove it from the vestibular sides of the upper teeth. So now that this piece of wax is placed between the jaws, this will help us with two things. It's not going to permit the tongue to get in our way, and also it's going to make it much easier for the scanner to go from the antagonist arch to the healing abutments. This also is very helpful when we didn't replace the healing abutments with higher ones, and we just used healing abutments that the patient comes in with. And right now, you'll see how easy it is. We do a second occlusal relationship with the icon on the lower left. And here I'm going to show you two things. On the side where we have teeth, I'm going to tell the scanner with a slider on the lower left to just scan teeth. This will help me tremendously because it's going to auto filter the information and it's only going to record the teeth. So I'm not in need to clean the mesh of this occlusal part. It's going to result in a very clean mesh, and you'll see it right away. Okay, so you see, it only scanned teeth. On the other side, though, I let the software optimize. On the other side, though, I'm going to go the complete way around, and I'm going to tell the scanner to actually image everything, and everything meaning even moving parts, because that piece of thermoplastic material very frequently gets in the way of scan. Doesn't image correctly and is filtered out. So, as you can see here, because we asked the scanner to scan everything, it so does. And we have the upper teeth, we have the wax between the upper and the healing abutments, and the healing abutments are showing very nicely on the lower part. And now, after the software optimizes everything, we'll have to stop and to cut out the wax from the scan. Why we do this is because neither on the antagonist or on the pre-op models, this piece of thermoplastic material does not exist. So it would get in the way of correctly matching the occlusion. So for the software not to do any errors on this side, we are just going to use this tool and remove any excess and any part of the wax that we used. I don't care if I lose a little bit of the healing abutments or a little bit of the teeth. I'm just interested to not let the material that we used in there. I also use island remover, the third icon on the upper left. I'm removing any soft tissue, unnecessary soft tissue. And you'll see here, I just clicked this icon, and if we click the little floating islands, they're going to disappear right away. And now we also have the second occlusion. Okay, as you can see, everything is in place. So these are the two ways we can do occlusion on the implant distal cases. Okay, now we go to the op stage, and in the op stage, we're going to cut out the healing abutments and image the emergency profiles. For this to be done in a correct way, I like to only cut the distal healing abutment, keeping the mesial one in place, as I am doing here. You see, I've removed it. And now I am going to block everything because this was scanned correctly and I don't want anything to happen to my already correct mesh. And I am going to add additional data in the spot I've already cut. Here you'll see something else I do differently. I tell the scanner to do a custom area scan. Let's see how we do this. On the lower right, when the scanning box appears, we will set the scanning box to a rectangle, and with that rectangle, we're going to scan the emergency profile. Why we do this is because, let's see, we check that box there and add a custom view. And this is our custom view. Why we do this is because when you're going to add the emergency profile now. The scanner, if it doesn't have this custom shape set, is going to also try and add data from the moving parts, and I don't want that. I just want it to read the fixed gingiva. Let's see how it does this. Okay, we start from the teeth and from the mesial healing abutment, and you see how easy it adds data and how clean it adds data. Okay, now we stop because we already have the healing abutment, and we take out of the emergency profile. And now that we've recorded the distal emergency profile, we're gonna now cut the mesial healing abutment out of the scan, as you can do here, we see here. And afterwards, I am going to block all data because in the distal I don't want my emergency profile getting modified, and also on the mesial I don't want the fixed gingiva to get modified. Okay, let's see this again. We're going to add data now. The same rectangle box to actually record the data. Everything goes smoothly. Because everything is blocked, what you can see here, scanner adds moving parts, but because everything is blocked, these moving parts won't get stitched to the final model. Now when we stop the scan, they're gonna disappear in part. If we have data that we don't want, this is the step where we can stop and also cut out that data.